Wide COVID cases are up nearly 50% in a week.
And the CDC says the Omicron variant is now responsible for 98% of new COVID-19 cases in America. And to talk more about the current COVID-19 surge, we're joined by Dr. Brad Baldridge from Providence, Little Company of Mary Medical Center of Torrance.
Dr. Baldridge, thank you so much for being with us.
My pleasure. Thank you.
Now, earlier this newscast, we heard from Dr. Anthony Fauci, who believes it's likely everyone will be exposed to Omicron. What do you think, doctor, about some people saying they actually want to get infected now to get more immunity? And could more immunity actually be a silver lining to this current surge?
Certainly more immunity is better. I think it's very risky and not a prudent strategy at this juncture to try to get sick. It's really impossible to tell how any given person will respond to the virus. So if someone voluntarily becomes ill, they may get really quite sick from that. And I think that's not a good advice. I would recommend that people get the vaccine. Each vaccine does seem to boost our immunity significantly. So I think the vaccine is the best way to go to prevent further infection.
So, doctor, let's talk about those new treatments. The White House has purchased Paxlovid. There's also monoclonal antibodies out there. Are they available to you, and are you using any of these treatments yet?
The pill medication is not yet available. That is coming down the pike, and we will be getting that hopefully very shortly, but that's not yet available here. The monoclonal antibodies is available at certain hospitals, and that is in active use, yes.
And Dr. Baldridge, ERs all over the country are seeing people who don't necessarily have an emergency. I'm sure you see them at your hospital as well. And they just want to be tested for COVID. Now, is there some sort of mental checklist we should use to decide if we really want to go to the ER?
Well, that's a good question. I think it's a question that a lot of people struggle with. I think certainly if you have COVID-like symptoms that include chest pain or shortness of breath, if someone has blue fingertips or lips indicating their oxygen level is low, if they have intractable vomiting or diarrhea, if they have mental status changes such that they're lethargic or they're not arousable or they're confused, those are really sort of hard criteria that people need to come to the emergency department for evaluation. The other symptoms are a little more difficult to assess. It does depend on somebody's immune status. If they're immune compromised, obviously there will be different guidelines for that. So it's difficult to give broad advice, but the features that I mentioned in terms of symptoms, certainly I would seek advice for those, seek treatment for those.
So, doctor, since we're on the topic of the ER, how is your ER holding up? And what about staffing there? We hear a lot of doctors and nurses are ill with COVID. How are you keeping up?
That's a great question. The nursing shortage is a national problem. Our administration has done a terrific job in aggressively recruiting. So we do have nurses now to staff our hospital and our department, and we're very pleased about that. There has been a shortage up until fairly recently here and everywhere. That has impacted the emergency department. We have opened overflow beds in the hospital, overflow units in the hospital, so that we can accommodate more patients upstairs. They keep coming in through the front door, and sometimes it's difficult to get them a bed upstairs, but we are addressing that, and that's gotten much better in the past few days. So the nursing shortage is certainly a big issue. I would say I would broaden that also to healthcare providers or healthcare workers, because whether it's transporters or technicians or other workers in the hospital, there are a lot of people who have been out sick. So it has had a significant impact on us.
All right, Dr. Brad Baldridge, thank you so much for joining us. And we know you're at the end of your shift, so hope you get home safe.
Thank you very much.
Thank you.